Good afternoon, everybody. Let's go through the data, some changes to testing, and then take some questions. Unfortunately, we lost another neighbor over the last 24 hours, a 69-year-old female. She did have underlying health conditions, but certainly we think about her and her family in this process. Looking at tests, 3,783 tests back. Our 7-day rolling average is 3.8%. Hospitalizations have increased. We now have 74 in the hospital. What we're seeing now is we're seeing more people come in, but we're seeing discharges happen sooner than what we did in the beginning of the pandemic. To give you an example, 15 new admissions into the last 24 hours. We had 5 discharges. 3 of those discharges were from the ICU. It looks like we're from the ICU, as we only have 6 people in the ICU now. But certainly let's keep our thoughts and prayers with those 6 individuals that they get better. 41 out of the 74 are Caucasian, 6 African American, 3 Asian, 2 of another race, and 22 individuals. We just don't have the demographic information at this point. Looking at positive cases, we now have 7,575. That's up 153 since yesterday. So out of a drop from our high of quite a bit of cases. Usually our trend has been Mondays and Tuesdays are a little bit lighter. Usually a high day usually happens around Wednesday. Part of that is the testing availability is more robust in the community during the week than on weekends. We're working on that to make some changes to try to keep testing capacity higher on the weekends as well. But 153 is better than, I don't know, what did we have yesterday, 238? So we'll take it. Out of the 153, there were no travel or senior facility cases yet. There's still being 58 community spread, and we still have 95 cases that are still being investigated as we speak. So certainly we'll update those numbers as we get them. We've had 6,047 people recover during the pandemic, and we have 1,311 active cases right now. So a lot of active cases as we speak. 4,119 of the cases to date have been female, 3,455 have been male, 1,046 under 19, 1,837 in their 20s, 1,043 in their 30s, 894 in their 40s, 1,065 in their 50s, 737 in their 60s, 431 in their 70s, 338 in their 80s, and 184 in their 90s. Looking at school testing, right now, starting tomorrow at the FSHED will be for symptomatic only school testing and for symptomatic testing. For those who've pre-registered for asymptomatic testing, I'm going to tell you in a minute what you can do, because you still can get tested, but we're going to have you go somewhere else. So if you are registering for your child and you want a saliva test at the FSHED, again, there's demand for this, so this isn't one of those things where you can just go on and then an hour later get a test. You go to mychart.upstate.edu. That's K through 12 high education or teachers or parents for a symptomatic test outside of K through 12 or K through 12 if that is busy. You can go to ongov.net//Cayuga Medical and register. So FSHED will just be symptomatic testing moving forward, and asymptomatic testing will now move here to the on-center tomorrow. We are expanding the hours. The hours will be 9 to 4. We now have built up our capacity to 450 tests a day. Last week we did hospitality rapid tests here. We're now going to do asymptomatic rapid testing here. You need to register, though, or else you will not get a test. The register for asymptomatic rapid tests, so this includes those who were registered at the FSHED for this week. We need you to switch over to this site. So it is covid19.ongov.net. So there's a lot of slots available right now, so nobody should have a hard time getting on and registering for that. Again, we'll be doing up to 450 asymptomatic rapid tests a day out of this building. Yellow zone school testing. Good news, over the weekend the state modified their guidance. Essentially, moving forward after 2 weeks of testing, if each school shows that they are testing below a rate of which the yellow zone percentage is, we no longer need to test in that school. So we'll start off the program and hopefully we'll have these schools out of the program in 2 weeks. So looking at where we were, the yellow zone positivity rate, I believe when this started, was 6.58%. So essentially anything below that, or below, we'll just say 5%, will basically mean that those schools no longer need to participate in the program. Why? Because that's proving what we all thought. We aren't seeing widespread in the schools. So if that is proven to be the case, why are we testing in the schools? We'll now go and use those resources in the community. Today we tested Liverpool and North Syracuse school districts. We've completed over 500 tests. Before I got here, we found 2 asymptomatic positive cases. So certainly we found 2 cases, but if you look at the numbers, that's a very, very good positivity rate. So certainly those schools do not have an issue right now. We have over 10 testing teams who now will be visiting each school and completing the necessary 20% tests by next Tuesday. Please watch out for communication from your school's principal or district superintendent about testing in your school if you're a parent. But so far so good today. First full day at it, and things are going well. And for the kids, it's not the big swab, so the kids are doing well, and pleasantly surprised is the feedback I'm getting from their experience. So, but so far so good. The nice thing with these asymptomatic rapid tests are we are finding those cases that could potentially lead to spread, whether it's the hospitality industry, whether it's faculty and or kids in schools, and we're going to open that up to the community as well. So those are positive things. Right now we have and have had kind of unprecedented activity related to new cases. When you compare it to where we were in the beginning of the pandemic, probably in the beginning of the pandemic we had as many cases, if not more. We just didn't know about them. But when you find them, there's a lot of work that goes into each case. And so certainly that's forcing us to do things related to streamlining our investigations. We can't be as specific with quarantines as we could have in the beginning of the process. We've had to tweak other policies that were nice proactive policies that people got used to that aren't as effective now as they were in the beginning of the pandemic, or when things were slowed down in the pandemic, when the virus was really on the run. New York State is providing an app to us that we'll make available to our positive cases. This will be very helpful to us because it will allow people to enter in their contacts and possible exposures into the app. And by doing this, this helps us with our contact tracing efforts, and it helps us have better turn times. So we're going to, each person that's a positive, we're going to ask them to use the app. Some will, some won't. But I think it's important to remember is that if you have direct exposure to anybody, you're of course going to be contacted. If there is a exposure that we believe is very risky to the public, of course we're going to let the public know about that. If there's a cluster that we believe has risk to the public, we're going to let the public know about that. One of the things that we tweaked our policy was something that we called the gap in the investigation. And the gap in the investigation, the terminology is probably not the right word, because this was not a substitute of we did not have a thorough investigation. What it was a proactive tool saying we have 10 cases in the community. We did contact tracing. We know the commercial activity of these 10 people for this period of time. If you were there during this period of time where this person may have been, watch your symptoms. We weren't suggesting you had direct contact, or else you would have been in contact with us, or we would have been very, there were some cases where we were very diligent saying we couldn't do an investigation, you need to watch out for this. That's not what we're tweaking here. What we're tweaking here is we can't have 200 cases and track down a day and track down the commercial activities for a week and put them out there unless there is direct exposure or direct risk for people. At this point, we know when we're out and about in the community that we need to do the right things to protect ourselves and our families. And that's wearing a mask, that's distancing, that's washing your hands diligently when you get home or you get back to your work or whatnot. But when we modified our policy, it was never modifying our policy as that you have exposure, we're not going to let people know that. That we always let people know that. And the gap in the investigation turned into something different over the period of the pandemic. When we had minimal cases, we could be very, very aggressive with each case and talk about each case. One of the constants, and you are probably sick of me saying this, but I am sick of having to say this, is people going to work sick. In my own operation, I have people that have gotten the virus, and I have people who have said, you know, geez, I had this cold every year. I just thought it was the same cold I have every year. That's not okay in the 100-year pandemic. So as a reminder to everybody, we need to rule out COVID-19 with anything of symptoms of COVID-19. And if we do this collectively together, we'll flatten this activity and we'll start to starve this virus out, because you will no longer be doing things and exposing other people to the virus. You'll be isolating, and we'll be boxing in that one case. So there's just too many cases of this. So we need to rule out COVID. We're doing everything we can to get quick testing. Turn times at the F shed are good. Obviously, if you're asymptomatic, you don't know that you have the virus, but for symptomatic people, this is too often the case. I get a sinus infection every year. I'm getting it now. I thought it was that. Well, it could be that, but it also could be COVID-19, and we need you to get a test. So, saying that, happy to take some questions.
Let him go first.
Could you walk through a little bit more what you're saying about streamlining the contact tracing effort? It sounds like it's obviously it's still being done, but it sounds like with the numbers that it's more of a slow grind than it was. Can you put some
Yeah, it is.
more detail around that?
Sure. You have, I don't know, was it 2 weeks, 3 weeks ago, we had, our high case was 90 cases. Then it was 100 cases. Then it was 150 cases. Then it was 220, not 238. So the amount of work, if I could have every resident in the community spend an hour to see the amount of work one case takes, I would, because that would put a lot of things into perspective of how serious this process is. So when you have cases like this, it's you have to do a case investigation where you're then, with that contact, developing all the potential contacts of one case, and then you turn them over to a contact tracer, and then they have to contact all of these contacts. And it's so cumbersome, and it's not just our region right now, it's everywhere, it's the whole country, but everybody's getting backed up. And when it's the same people that have been doing this every day for 7 months, 8 months straight now, it's a lot. And that's just you have to modify when you have caseloads like we have had, and get what's most important done first, and then you got to go backwards. So it doesn't matter even adding on to each team that we're doing and moving people all around, and even with the state's program, everywhere in the state seeing increased cases, many regions more than us. So it just is what it is. That's why we need the community to respond and to rally with us. And that's why this app's a new tool, where some of the work that our investigators have to do, if some people can do this themselves, especially those who are tech savvy, that helps, and it's a big team effort.
I think the standard expectation was that within 24 hours of getting a positive test, you would get hold of that person's close contacts?
That's the goal. Yeah, I don't know if it happens every one now, but that's the goal. Mind you, you may find out about a positive test before we do, because you may get it on your own My Chart, or you may get it from your personal physician calling you. We get it when it comes through the Eclair system. So if the Eclair system gets backed up a little bit, which it may be, I don't know if it is or isn't, then you know, that gets backed up a little bit to us, and then we do this. That's why we set up some protocols. For example, with if you find out that your child has COVID-19, you alert the school. We then have the schools, if they find that out, usually send out some sort of communications for precautionary quarantine. Then once we get it, we start our investigation and the contact tracing after that. So the reality is we're in, kind of uncharted territory now with caseloads. Got a little bit better today, and looks like it may get a little bit better tomorrow. We'll see. But we're all adapting at every level to react and respond.
Do you have enough bodies? Is the state providing enough contact tracers to help with all that work?
Yeah, I think we have it's a fluid situation with bodies, right? So I'm not sure exactly where the state is with their contact tracing efforts. As far as I know, they're beefing up their teams too. Everybody's trying to beef up staff. I know there's people we tried to hire on an interim basis to help with this that the contact tracing company hired. So it's a fluid situation, and everybody is doing everything they can, really sparing no expense to get their arms around the caseload so we can get these turn times where they're effective. At some point, if you can't do it over a period of time, it's not effective. So that's what we're racing against.
There are clearly real people examples where this ideal timeline isn't bearing out true. I've heard from people who knew there was an exposure at a school, in this case a preschool, knew their child was exposed, just heard from the health department a week later with some vital information about how to isolate the child, how to deal with the child's eating, clothing, laundry, but it took more than a week to get that information to these parents. How do you try to improve that as we go forward if there's vital information taking days, if not more than a week, to get to some families?
Yeah, I haven't heard a week, Andrew. I'm not suggesting anyone's saying anything different, but that's the first I've heard of that. And again, investigation is done by us. Contact tracing is done by the Bloomberg team through the state. So with parents, if we're in a situation, we've all been following this situation. It's very it's a scary thing with our kids, right? Nothing scarier. So we know what needs to happen if there's a potential exposure, right? You need to quarantine your child of a potential exposure and wait. And certainly some of the details in isolation. Right now, there's 2,700 people in a quarantine. There's 1,300 active cases. So the amount of connectivity and contact that the people had in the beginning of this process to right now is a lot different. And that's 1 week isn't an acceptable timetable, certainly, but I think that's probably the exception more than the rule.
And I want to hammer down a little more just so people are clear about how you're shifting the strategy a little bit based on resources. What you're saying is if there is imminent threat of exposure that you can't identify each person by name, you would put out some sort of
Correct.
notice. But in these general store type of general exposures, it's just too cumbersome with this caseload to be putting that out as regular.
In the value, so, and I've gotten a lot of complaints about this, the value in some of what we did was really such proactive steps. Someone shopped at Lowe's this time during this day. Watch your symptoms. Someone shopped at Lowe's with the virus. Watch your symptoms. The goal there was to say, watch your symptoms. What we're saying now is everybody should watch their symptoms. That's the value in that message. Someone probably shops at Lowe's that has COVID that we don't know about. So what do? We watch our symptoms. If we have a known case where we've had 4 or 5 workers at a deli, at a grocery store, who have people in close proximity, that's different, right? If we have a known cluster at a restaurant downtown, that's different. But where it got to over the summer, and again, sometimes you can regret some of the success you had early on, is we had 5, 6, 7 cases during the summertime. We contact traced so well, we knew everything they did for 2 weeks. So we were saying, okay, if you're here or there, we hear from somebody, we talk to them, maybe we evaluate. It was a very proactive tool. We can no longer do that proactive tool. But the message of this was never, if they shopped at Lowe's, we think you were a direct contact. If we thought that, we would be very specific about that. Person point A went to 8 different spots that day, et cetera, watch your symptoms. The message was watch your symptoms. Now everybody's going, we have 200 a day, almost 200 a day for a week, right? Everybody's going everywhere. Let's watch our symptoms.
No good deed goes unpunished.
Yeah, and this one we're getting punished. I responded personally to about every single one of the emails that I got from it, so I feel better about that. But certainly, it was never, people got confused. We never substituted contact tracing with a release about somebody being somewhere. That's never what occurred, and that never will occur.
I'm wondering over the months of those possible exposure lists, if any of those actually yielded a notable amount of positives, or if they were just so proactive and the contact tracing was so thorough that it never actually resulted in anything.
Yeah, we don't think those did, right? This is just something we put out because we could. And now we can't, and people got used to hearing that, and they liked hearing that. But what we will do is, if there is direct exposure, obviously, and if there is a cluster of cases related to where we think it's a jump ball, then we will. But some of these things weren't jump balls, Andrew. Some of these things where we did an investigation, we released every bit of information from the investigation out, and what was the recommendation? Watch your symptoms every time. It wasn't go get a COVID test. It was watch your symptoms, because we only tell you to go get a COVID test if you're a direct exposure. So so our advice now, everybody in the community, watch your symptoms.
So what is the threshold for that? Is it 2 people at a restaurant? I mean, when will you put out something?
Whenever we can't do thorough contact tracing and the circumstances merit that type of release. So you're never going to have a one-size-fits-all for that.
As far as testing capacity goes, and I know that you guys have moved some things around like you just announced, the fairgrounds, we had some people who say they made an appointment but ended up waiting an hour and a half in line to get a test. Are you guys having issues with certain areas? So
what happens with these, and again, the fairgrounds is being run by Upstate, but what happens with any drive-through testing site, whether it's Syracuse Community Health Center or the F-Shed, the fairgrounds, if people don't pre-register, what do? You drive up and you're in line, and then you're not registered and you need to pre-register, then that person has to get out of line and leave, and that's what slows these things down. So I don't know the specifics of what that is. I know at the F-Shed we had a bunch of people not pre-registering, showing up for a test. That slows things down. So I'm sure that has a lot to do with it. And we move things around because right now symptomatic testing, there's an increased symptomatic demand, as we know there would be with the virus being here more prevalent, also with other cold and flu-like cases developing. So certainly we need the F-Shed to be designated for symptomatic testing. We'll do all the asymptomatic testing here.
What challenges are you seeing to truly scale up testing more? Because if there's any kind of line, clearly there could be more supply available, right? What
Yeah.
more could you ask for in terms of supply and venues and that kind of
Yeah,
thing?
the challenges are you need qualified individuals to work these sites, right? So just like Tim's point about our health department, these are the same people doing this work for 7 straight months with no vacation, nothing, dealing with very difficult material, right? A lot of people who are very sick, some people who die. At Upstate, in Crouse, and St. Joe's, it's the exact same thing. It's the exact same thing. At Nessentia Health, who's a partner, it's the exact same thing. So your capacity for professionals that can work the sites is a challenge. Second is, and I'm glad you asked this question, we get a lot of, you need to get more rapid testing. Okay, I want more rapid testing. If I could buy more rapid tests now, I would. I'd buy millions of dollars of them. That's not how it works. The federal government has a contract with these large providers of tests. Then they allow the states to. The county of Onondaga can't get our own contract. I have talked to New York City about using their buying power. We were going to do that. They called me up, Ryan, I can't even get these rapid tests now. We've talked to the state of New York about getting some of these rapid tests. The state of New York says, let us look into it. Say, Ryan, we're having a hard time getting these. So I've now called the federal government. So we are trying to get some of these things that make it easier. We have rapid testing machines, Abbott ID Now machines. We don't have the kits. We have very few kits, so we have to use those surgically. We would buy millions and millions of dollars of kits if we could.
Ryan, given the scarcity of the rapid tests, and you mentioned now that you only have to do tests for 2 weeks in the schools as long as they provide the right results. Is that a misuse of that resource, since we know, or it seems that transmission is not that big a deal in schools? Should those be made more available to the public at large?
So there are two different, so the asymptomatic rapid test is different from the symptomatic rapid test. So I can't get my hands on the symptomatic rapid tests. We have enough asymptomatic rapid tests to get us through certainly the month of November going into December, to do the school program, to get these schools out of the program, right? Most of them will be out of the program if the data holds up like today's data. And then we go into the community with the asymptomatic rapid test to try to find the pockets. I would love to have symptomatic rapid testing as well, and we're trying every day to get it, and to get it with quantities that can drive outcomes. Right now we have some kits that we use for emergencies, but the reality is I've been trying to buy millions of dollars worth of Abbott ID Now test kits for 3 weeks now, and we are yet to be able to fulfill an order.
You mentioned Mondays are usually low on case numbers, but 153, that's still pretty high. So how concerned are you for the rest of the week?
Yeah, we'll see what Wednesday, brings. I don't know what last Mondays were. Usually they are lower. I think this number actually has more than 24 hours into it. I think it's a blend of, some yesterday and maybe some over that the state counted for tomorrow. But we'll see what it looks like. But yeah, we don't want to go higher than where we've been. I think what the community needs to remember, and we've been doing this a while and we forget these things, but the actions that the community takes today will be reflected 10 to 14 days from now. So we've been talking yellow zone for a couple weeks now, so we should start to see this thing go a little bit in the right direction when you look at some of the mitigation that's happening and some of the wide messaging that's been happening at the state and local level. So percentage-wise, we had a pretty good day percentage-wise, dropping off from yesterday. But certainly, we're always concerned about Wednesday and Thursday, because that's usually Monday's folks who are sick that are going to get their test.
How mu-
Yeah, so we haven't seen, we were going to go up last week, and that got rescheduled because of some of the high caseloads up on the university. Certainly, we're very aware of Coach, and we wish Coach well. He's gonna do great, and he'll be fine. I heard he's feeling well right now. But we're going to analyze that technology, and then see if we agree with the technology and if it works. Correct, and I'm a big basketball fan, so some of the selling points hit home, the 2-3 zone, right? And they're not necessarily with one person for that long, moving in and out. So I think there's some merit, and I think it's very smart of them to do what they did. So we're going to look at the technology and see if we agree with how effective it is. Yeah, so I think Coach, I know Dr. Gupta talked to Coach, and so she's in on that one. We want to look at it more as kind of moving forward. We agree with this, and we're going to use this moving forward with that. So I think this week we're going to be introduced to this and then have time to study it. Yep.
How many schools were done today? You mentioned the districts.
Over 7, or today was North Syracuse and Liverpool. Was that 8? 8? Yeah, I can't see that far, Ann. You got to 8 schools.
And there was more good news on the vaccine front today. I'm wondering what conversations are happening at your level about getting a vaccine, storing a vaccine, distributing a vaccine in Onondaga County. Yeah,
we want to see. Okay, we watched the conversations with the administration and the governor's office and the back and forth. We're talking to the state about what do you think our role is going to be, so we can start preparing for that. I think your initial doses, right? You'll probably have distribution in nursing homes, so that's probably not as cumbersome as what the second round and the third round and the fourth, fifth, and the sixth look like. But certainly the governor, I know, has his own concepts that he thinks will work. We'll certainly be a part of that. We would like to know more what that looks like earlier than later, so we can move the deck around if we have to.
No real information?
Not yet. Not yet. We're very happy. I mean, I think that's kind of what's different now than March, April, and May, is we have this activity. We know what we got to do to keep the economy open. It's very disruptive to everyone's personal lives, but we never had a vaccine ready then, right? We didn't know how long this was going to go on for. Now we have the vaccine that certainly it looks like the FDA could give either company, Moderna or Pfizer, emergency approval in the next week or two. And then certainly it looks like there's doses that will be ready for distribution. How many our community gets yet to be seen.
What's the update on the upstate party now that they're out of quarantine and the case number?
I don't know how many. I know there was more than one, but I don't have, I never got a follow-up number on how many there were. But again, that's a good learning tool right there. That I think the number one example of COVID fatigue is when you got people who are inundated with this every day who still make that type of gathering decision, right? So it's good for all of us to learn from and not make that mistake.
How close is the number of hospitalizations getting to where it would be a concern? Have you talked to them about whether they're worrying about maybe having to impose more restrictions?
Yeah, so right now we're okay, Tim. A couple of the hospitals are actively wanting patients if that happens, right? So, what's good now is you have the whole network in Central New York communicating with each other, looking at that. I mean, I think the number of beds is over 1,200 beds in the community. So we're not at a critical mass right now, but the infrastructure is not just hospital infrastructure. To your point today, it's our public health infrastructure, and certainly that's being strained. And the hospital numbers, if we weren't better at treating this virus right now, I think we would have a real problem, because our turn times are so much faster now than they were before. But thank goodness we're getting better at treating this.
You mentioned the public health infrastructure, and I think the point you made often when schools were about to reopen was, if we get cases, we can test them, we can contact trace them, and we can box them in. With the number of cases now, can we still box it in, or does it rely on a greater community-wide effort?
Yeah, I think right now it's not as fast, that's for sure. So you're having to reaffirm and send in more troops to help your medical infrastructure from the public health standpoint. And so that's stressful, and we're never going to be untruthful about that. What we do feel good about is the example you brought up is the K through 12. Is we, again, have consistently seen 5 to 10% of the cases are coming from K through 12. And they're not being transmitted in the buildings. They're coming from the community into the buildings. And so we feel very good about that. And that was a big worry, that was going to be a setting that could drive a lot of cases, and that hasn't played out, which is a positive thing, because certainly we want our children in school. They've had a tough go with this. So, but to your point, our medical infrastructure from a public health standpoint is being tested, and we continue to move around our own operation to help make it work. We had our busiest week, I think, of the pandemic last week, so it will take us a little bit of time to get through it, because sometimes even when you have more bodies, if you have to retrain or train them to something new, that takes more time. So sometimes it's better just to get through the grunt of it all and then incorporate the new bodies instead of having to sit there and train them to something very specific.
Quick clarification on the yellow zone school testing adjustment. It's still 20%, but it's only for 2 weeks?
Yeah, so after 2 weeks, if each district's data is below the yellow zone data, they no longer have to be in the program.
But it's 20% of the same
Correct.
in-person students and faculty for 2 weeks?
Correct.
And does Monday and Tuesday, did you clarify of next week, pre-Thanksgiving, count as its own week? Did you figure that out?
It's the second week? Yeah, that's the second week, Monday and Tuesday.
And my last question, I think, the Board of Elections confirms 8 cases there. Do you have any comment on what's happening at the Board of Elections?
Yeah, I mean, again, when you have that many people in a room sitting at a table, whether you're playing cards or whether you're counting ballots, there's risk. And that's what happened in this case. Somebody had it, spread it to one person, they spread it to another, and you had many hosts in the room. So it just shows you how infectious the virus can be and contagious.
Are you involved in any conversations, because it's essential work and there's a deadline with the state to certify votes?
Yeah, being my role as the CEO, but also there's a political element to my role. As far as the science goes, we're letting Dr. Gupta work with the 2 commissioners so that there's no perceived conflict of interest.
Have you been in touch yet with bars and restaurants about Thanksgiving and Thanksgiving Eve, and are you planning heavy enforcement?
Yeah, so right now, the SLA is part of the zones has been out very heavily in visiting many of our hospitality facilities. And again, we're communicating with the proper associations about what the facts are on the ground and what their members should really look for. Obviously, SLA is an important organization to them. They can take away a license, which is lifelines for many of these operations. So certainly there's the expectation that you need to follow the rules, and they did over the weekend. If you were driving through downtown 10 o'clock, the lights were dark. So I think that's necessary. I know for these businesses it's a sacrifice, but right now it's necessary. There are multiple cases that have been contact traced to the hospitality establishments. Other questions? Okay, thank you. Hopefully next time we see each other will be Thursday.